My name is Dr. Louis Gross, and I'm a holistic dentist. I've been a dentist since 1979, graduated from Columbia University Dental School, College of Physicians and Surgeons, and I consider myself a tooth whisperer. I feel like I have an intuitive sense of diagnosing conditions relating to oral problems, and I think the key to being a tooth whisperer is, of course, you listen to the teeth, you listen to the patient, and the problem with modern medicine is the doctors are too busy telling the patients rather than listening to them. I often think people know what's wrong with their teeth before they even come in, so that's why it's very important for a doctor to listen to the patients.
He's removed a tooth that was, pulled a tooth that was in quite painful and very bad condition, serious gum work that would have led to teeth deterioration. And so far, that's at least 10 or 12 years ago. So far, the teeth are still in place, so I guess it was successful. But it's covered everything from routine cleaning. This was a win-win situation. A genial man doing, I feel, very, very good work.
So I graduated from Columbia in 1979, and I did a residency in hospital dentistry, and then I studied at the Armed Forces Institute of Pathology, and I'm a consultant to the New York City Medical Examiner's Office. I think these give me a special background in diagnosing, which is a matter of listening to the symptoms, but also using very high technology. We use low radiation x-rays that have 90% less radiation than a regular dental x-ray. We use special cameras. I consider myself a holistic dentist because I believe in doing minimally invasive dentistry. Often the best thing you can do is the least, and unfortunately medical care in this country is driven by insurance companies, and the doctors are trained to practice as a business, and it's often not about healing people. It's about, you know, what the insurance company allows, and I don't practice that way. A holistic dentist should look to save tooth structure. So when you come to my office, if you had a cavity, rather than just immediately recommend a root canal and a crown like many dentists do, I would choose to conserve the tooth structure, use a special herbal filling that we have that calms the nerve and often keeps the teeth alive. And I recommend to my patients that they try to not only keep their teeth, but keep the teeth alive and not do root canals. And you'd be surprised how often, I would say 50% of the root canals done in this country are not necessary. The patients have to be informed and ask a lot more questions of their dentist before they just automatically assume that they're getting the right treatment. You get a list throughout the country of dentists who practice low invasive, no mercury fillings, less root canals, and the dentists are all over the country. You just have to look at and find one who practices like that. When you come to my office, it is special because it's an integrative dental practice. This is the only place that I know where you can get all the different dental specialists in one place with different holistic healers. So we have on our staff an oral surgeon, a board-certified periodontist.
I'm a specialist who treats gum disease, and I place dental implants. I do bone grafting and sinus procedures to help redevelop areas that have lost teeth. It's important that patients understand that gum disease is a silent disease. It's actually a painless disease, but it is an infection nevertheless, and it's very destructive to the teeth, gums, and to the surrounding bone. There are current studies showing that the infection involved in gum disease infects the heart, it can affect diabetes, it can lead to preterm low birth weight babies as well. So it does not just affect the mouth, and that's why it's important that patients come into the practice and are properly screened and treated.
We use a nutritionist. It's become more apparent now that a holistic approach is to look at the whole patient and not just a particular tooth. Dr. Markowitz is our oral surgeon. We have an endodontist, we have an orthodontist who does Invisalign, and all of these services can be combined with holistic healers. You can have cranial sacral massage as well as having orthodontic work. Now that's important because when you do orthodontic work, you're actually not just manipulating teeth, but you're putting pressure on a different skull bones, and a craniosacral technique will release some of the stresses that go along with that.
Very nervous about going to the dentist, and I finally fell upon Dr. Lou and Gross, and he seems to give me a comfort level, which is really, makes me feel really relaxed, and I'm just really happy that I found him. This one tooth in my right rear here, the last tooth, where it would be, when the dentist would go in there with the, just pick it or just touch it, I would just jerk my head and it would kind of freak me out, and I just had an anxiety about not ever going to the dentist again. When I went to Dr. Gross, the tooth was extracted, and I found out the tooth was actually half dead and half alive and in my mouth for years. I've had about over, I'd say, 15 to 20 dentists in my life, trying one after the next, trying to get to a comfort level where I could just relax. I was brave and I went in and I tried it, and I ever since then, sometimes it takes going through a lot of people to find the right one, and you know, I've tried the rest, and now I've tried the best, so I'm very happy with the results.
If you have periodontal disease, we find that people are very acidic. Their saliva would be acidy. And the nutritionist can put out a special diet and using different herbs to buffer your saliva, which would make you less prone to the anaerobic bacteria that cause periodontal disease. Another application of an integrative dental approach is acupuncture. We have on our staff facial acupuncture for facial rejuvenation, which is a new way of doing non-invasive cosmetic work, cosmetic surgery without any kind of surgical approach. You can also use acupuncture to improve the immune system if somebody has infections. We also use acupuncture as an alternative to anesthesia. So if you are concerned about the chemicals in dental anesthetics, we offer the services of an acupuncturist. It makes it much more comfortable to have a facial massage before surgery, and it releases the stresses of the mouth. And then a week later, you can have lymphatic drainage of the face and throat to remove a lot of the swelling that occurs after your wisdom teeth. And that would be done with the services of an oral surgeon. And as I said, we're the only office that I'm aware of that offers these special services.
I'd recommend people to go to Dr. Gross to give it just to try it and see how they feel. And there's new approaches to dental work these days that are very different from the old days, and people just put it on the back burner and just delay and neglect it, and things build up, and sooner or later things fall apart. So it's really important to get to the dentist, and I recommend Dr. Gross to everyone.
We offer a full range of cosmetic services, laser bleaching, and the new lumineer technique. Lumineers are very thin porcelain laminates which you can place on teeth now without any drilling or injections necessary. So it's a cosmetic way to get a real Hollywood powerful smile. That's new technology. We also have alternatives to the Mercury amalgam fillings that are less invasive and less costly than a lot of the traditional materials that dentists are using. The heat-cured resin inlay, which is a very nice, less expensive alternative done in one visit, as opposed to your traditional gold or porcelain inlay that a lot of other dentists are now using, and is a nice alternative when you might need a crown. If you'd like to come and watch, we're going to do a little demonstration of a before and after of a young man who fell on his tooth and chipped it, and we're going to bond the tooth, which is a one-visit procedure for rebuilding the tooth cosmetically without reducing any tooth structure. So it's a very nice procedure, and it saves the patient having to need a root canal. So I'd like you to come watch, and we're going to give you a quick demonstration.